Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Sally Daganzo. She's an internal medicine physician. Today's Kevin MD article is How Functional Medicine Fills the Gaps Left by Conventional Care. Sally, welcome to the show.
Thank you. Glad to be here.
All right, so let's start by briefly sharing your story and journey.
Well, my journey into medicine was a bit circuitous. Like a lot of people, I'm sure, grew up with a sick sister, so medicine was always in the back of my mind. She actually passed away about age 10, older sister. And I initially did grad school in physics, and then I did management consulting, and then medicine kept kind of pulling me back because I liked sort of the science aspect, but also the complexity of always learning something new and getting to apply it to the real world versus like physics, which is very esoteric, I guess, at least in my opinion. So I ended up at UCSF in San Francisco doing medicine, and I bounced around from every single specialty thinking I might do neurosurgery or transplant surgery or, you know, you name it. I thought it might be a good fit. And so I ended up in internal medicine because I couldn't decide. And that was a way of like punting down the road. And then just kind of stayed in there. I didn't really want to specialize because I really like everything. And so that's kind of what I did. And then I've done various things along the way with internal medicine
All
from
right.
Hawaii to back to California. So
So
here I
tell
am.
us about, before talking about your article, what functional medicine is and how did you first get interested in that?
So functional medicine is a bit, I mean, I guess I was thinking before I came up today, is it actually there's this term that most of your audience probably knows like functional neurologic disorder or functional dyspepsia or functional this, functional that. And I don't know if the term came from that, but that's a lot of what I think functional medicine physicians treat. Something where we don't have a test like a lab test that tells us, you're anemic and therefore it's, iron deficiency anemia. We look more at the root cause. That's sort of the buzzword is like what's underlying it. Is it your genetics? Is it the environment? Is it trauma? Is it a blend of all of those things? And so to me, it's going back to kind of like the basics of the first couple of years of medical school, which I don't know that many of us really even think that we're using on a day to day in our busy practices. So that's what drew me to it was the scientific aspect of really getting to the root cause of a particular person's situation. Personal, it's kind of like personalized medicine, I would say, where your chronic fatigue versus your next door neighbor's chronic fatigue are very, they might have the same phenotype, but they're not the same story to get there. And I think in busy practices, it's really hard to do that actually. That's sort of the next step, I think, in it. But that's what drew me into functional medicine was basically this root cause approach of getting to think more deeply, getting to go to PubMed and look for articles that are case reports and what might be going on with this person. More challenging cases, I guess, which is what I've always enjoyed. Yeah.
So, your Kevin MD article talks about how functional medicine fills the gaps left by conventional care. For those who didn't get a chance to read your article, just tell us more about it.
So, I mean, basically, I mean, part of why I wrote it is, I think there's this notion out there that functional medicine is more complementary, I would say, and there is that term of complementary alternative medicine, but it's integrative and it's complementary and it's basics. And so in the article, I was trying to just sort of dispel the myth that functional medicine is this like other. It's not this other thing that is like a mystery. It's actually what all, at least internists or anybody who went to medical school are well equipped to practice. There's nothing like new or groundbreaking that you learn. I mean, the learning is fantastic if you go through a rigorous training program like the one I did, but it's going back to like how does the mitochondria work and what things are toxic to the mitochondria and why might that lead to this person having illness. But that's not something that when I'm meeting somebody with type 2 diabetes at my last job and I'm treating it, we're not thinking about that. It's just not. It's conventional medicine has gotten down to sort of algorithms for the most part, at least in primary care, where it's like you had a heart attack, you need aspirin statin, or, that's one example. And that really, to me, that's like so boring and that there had to be more to it. And so I was just trying to dispel the myth that functional medicine is this like, you know, out there magical thinking. It's really not. It's really scientific, and that's what drew me to it. My background in physics, I'm open-minded, but I'm still scientific, and I think that's important for people to recognize. It's not just some made up science or woo-woo medicine, as we might call it. It's actually, very rigorous and difficult. It's actually really hard. So you have
So
to
you're
remember all the basic science.
so you're an internal medicine physician. Give us some examples of how you would incorporate functional medicine in your practice, the types of patients you would see, the types of conditions that you would treat that would require a functional medicine approach. What exactly would that look like?
Oh, that's a great question. I mean, I actually primarily treat eating disorders, which is not always best for a functional medicine approach. A lot of functional medicine is lifestyle, nutrition, interventions that are not medications, what we call like pill for an ill medicine. It's more like getting a couple of the tools that we use are a timeline, which is really just a good history that we all know how to do when we do an H&P. So getting a history, and one of the big things is, when did you last feel well? So it might be somebody coming in with like fatigue,
Hmm.
or initially actually what I started with was things like, it was kind of like long COVID, which lends itself pretty well to functional medicine. I think most of us have seen the post-acute sequela of COVID, or long COVID patients, or POTS. So those kind of people might have been to different specialists who kind of say, oh, if it's POTS, just take
Hmm.
propranolol, or if it's, fatigue, take a stimulant, or go see a therapist. There's kind of like these easy, not easy, but there are these like prescriptive answers
Hmm.
without looking a bit more holistically. And if you get more of a timeline going back to like, I mean, to the extreme, I mean, in functional medicine, we're like, were you breastfed or bottle fed? And how does that affect your microbiome? I mean, it's a lot. But if you kind of go back to what are all the things in this person's life that led up to them feeling just with kind of like a complex illness. And I would say like POTS might be a classic one, or long COVID, or myalgic encephalitis, chronic fatigue syndrome is another one that a lot of doctors can't stand, fibromyalgia. All of those, there usually is a pattern of dysfunction. We use the word systems biology. And so
Hmm.
instead of mapping it to like the heart or the lymphatic system or the brain or the GI tract, we're mapping it to systems like energy production, communication, and that's how the whole body coordinates itself. So, for example, if it's like energy production, it would everything from what are you eating, how is it
Hmm.
digested, how is your body taking it up, and then how do your cells process it, and how does your mitochondria work? Like that's a whole different, it's something that all of us have learned and we're all familiar with, but it's not something that on a day to day, at least for me in my former practice, I was able to utilize or implement. I just wasn't thinking about it.
Hmm.
So to answer your question, I mean, the typical person that would need a functional medicine approach is anybody with like a complex illness that maybe they were told that's functional. I think we know that term functional, that it was in their head. It's not just, a surgical issue, or,
Hmm.
gallstone pancreatitis or whatever. It's more the nervous system, just more complex. But it's something that takes more time, which we're
Hmm.
not given. And that's sort of my struggle with how to fit it in is like the next step, how to fit it into like a busy practice, how to still take some of the tools that we learn in functional medicine and we learn in medical school and integrate them little by little. A lot of it's lifestyle medicine and dietary medicine, but it's also really like partnering with your patient and
Hmm.
believing them and trying to help them get to wellness, which sounds just like primary care.
Yeah, so I think
Yeah.
that leads me to my next question because it sounds like functional medicine. It's a lot of the preventative medicine things that we do or we're supposed to do in the exam room. I'm an internal medicine physician myself. I do primary care. But like you said, a lot of this stuff takes time, especially taking a holistic approach to a patient's problems. And in a typical 15-minute visit, very difficult to do
Yeah.
that. So you said earlier that you want to take some functional medicine tools and try to incorporate that into a conventional primary care practice. How do those two models intermeld if they can be combined at all?
I mean, I definitely think they can. And I think where I used to work, they actually, in retrospect, they're actually using some of it. But getting a relationship with your patient is the first thing. And you can do that in 15 minutes if you preface it with, the right way. We've got 15 minutes
Hmm.
and let's get to know each other in these ways. And here's why I'm going to ask you if you were, had a C-section, or if you were, vaginal birth, or whatever thing you're going to ask them. I think part of primary care is you actually have a longitudinal relationship. So I think in primary care, it lends itself very well to that. But the other things that they use, at least in the Institute for Functional Medicine, which is where I did my training, there's a big emphasis on a team model, a team-based model where there's health coaches or there's multidisciplinary approach. And I think so it's not just the physician. It may be that I'm taking the history, or I'm making something prescriptive about their lifestyle, or how to improve sleep, or how to alter maybe their dietary intake or other things like that. But then I may pass that along, and maybe it's a group visit with a health coach and other people are learning something similar. So and a lot of people don't like that idea, because it feels less personalized. So, but there are ways to do it like that. I mean, that's one way that works really well. A lot of my colleagues that have been doing functional medicine for a long time work it's a requirement that all of their patients work with their health coach,
Hmm.
because they get better results to implement some of these changes that require motivational interviewing or other sort of habit changes, which for it's hard for our time for a patient to, see us every week or
Yeah.
whatever. So that's one way that is effective, that I think it is easy to expand on.
You said earlier that sometimes functional medicine gets classified or misunderstood as fringe or unscientific, despite what you said is a rigorous evidence-based foundation. Why do you think functional medicine gets that bad reputation?
I mean, I guess I might blame social media, which I'm not totally on social media all the time, but there's a lot of people that can go and just, right, there's not a board, well, there will be a board certification for it starting next year, actually, to help remedy that. But anybody, my next door neighbor is a chef. I don't know, he could call himself a functional medicine chef or functional medicine practitioner. There's nobody saying you can or can't. So I think part of it is just anybody can say it.
Hmm.
And so they could be doing, quantum water, or I don't know. There's so many things out there that are very dubious and not, I mean, that's just one example. And so I think that's where it's just watered down. It's not like, oh, I'm a cardiothoracic surgeon. Everybody
Hmm.
kind of knows that's, my neighbor can't say that. Well, maybe he could, but I don't think so. And so I think that's where it comes from, and people see it as, yeah, sort of fringe.
Hmm.
But it's really not. It's just not. It's it's just basic science, and I'm trying to apply it and using, it's evidence informed rather than evidence based, I guess. Like it's evidence based, but then it's a little bit more inclusive, because my patients that are sick don't want to wait 20 years for Lilly to do a randomized controlled trial on low dose naltrexone for long COVID or whatever it is. So there is this like partnership of, do you want to try this thing that's not, it's not FDA approved, or, whatever. Do you want to try it now, or do you want to wait 20 years? And there's this kind of like risk benefit, and you
Hmm.
have to go to PubMed, open evidence, whatever, and look for data and partner with your patients to do that. But I think a lot of people practicing out there just say it because it's a
Hmm.
buzzword, and which is part of why I wanted to write the article, just to kind of lend some legitimacy to it, that it's a real thing, and for people to ask good questions when they're seeing somebody who says that they offer it, to make sure they know what they're getting into also.
Now, for the patients who are listening to you and are interested in a functional medicine approach to their conditions, what are some things they should watch out for or look for when searching for a functional medicine clinician?
I mean, I'm a bit biased. I think that it's a red flag if somebody's practicing functional medicine that is not also trained in what we would call conventional medicine or traditional medicine, because I think in order to practice functional medicine, you need to know all the guidelines and
Hmm.
everything else. So I do really feel strongly it should be a blend and not one or the other,
Hmm.
that it should be holistic and inclusive. And so, if you're going to go see like I don't know, an acupuncturist or something, acupuncture does have a role in medicine. I don't think I don't think too many people disagree with that. For a lot of people, it helps with different conditions. But if they're going to be prescribing you medications, which would be supplements, right? They would be vitamins. That worries me. I include vitamins and supplements as pharmaceuticals. I put them all in the same category,
Mm-hmm.
whether I write a prescription that requires my license or not. And so for me personally, that's a red flag because if this person doesn't really know when you would use atorvastatin or semaglutide or whatever, what have you, then how can they know how can they know that they're giving you the best care? I
Mm-hmm.
think you have to use all of the tools. And so for patients, I think that it's best to have somebody who is equipped with all of that, which may be hard to find, but it's getting easier, or to at least have somebody who's open-minded to that
Mm-hmm.
and to work with their primary care on being collaborative.
We're talking to Sally Daganzo. She's an internal medicine physician. Today's Kevin MD article is How Functional Medicine Fills the Gaps Left by Conventional Care. Sally, let's end with some take-home messages that you want to leave with the Kevin MD audience.
For people to be their own self advocate and not be afraid to ask questions about to their primary care or another doctor. Now with AI and everything, patients can be even more of their advocates. And yeah, I love it when people bring questions. So I think if they're not sure, just ask. And if you feel gaslit by your doctor, just look for another one. Like there's still so many great clinicians out there. It's worth partnering with one that is somebody that you feel comfortable with. I
Mhm.
think that's the biggest thing in wellness to get well.
Sally, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.